Myself, Basil Iskoshi, and I'm a first-year nursing student at the University of Southern Queensland. Today I'll be discussing the case study involving Olivia and Mrs. Osher, focusing on therapeutic communication and how it applies in a disaster or emergency context. I'll be analyzing the scenario in depth and answering the 4 questions provided, highlighting how effective communication influences patient safety, emotional well-being, and clinical decision-making. In this scenario, Olivia's communication style had a very crucial impact on Mrs. Osher's emotional state and ability to engage in the assessment. Mrs. Osher was visibly distressed and focused on her home, which is normal after a traumatic event. Instead of considering that fear, Olivia ignored it by saying things like, "This isn't nonsense," and "Checking on your house is the last thing on my mind." These statements immediately shut down the patient's emotional needs. As a result, Mrs. Osher became more anxious, more defensive, and less willing to participate in the clinical assessment. Therapeutic communication depends heavily on empathy, presence, and active listening too. But Olivia's tone come across as rushed, impatient, and task-focused. This mismatch between the patient's emotional needs and the nurse's communication style reduced trust, increased distress, and limited the effectiveness of the assessment. In addition to this, the emotional safety of the patient was stressed, and without emotional safety, the patient cooperation naturally declines. A study from Akairam et al. 2022 states that there can be used several therapeutic communication strategies to respond in more cooperative way by still maintaining the clinical priorities which Olivia could have adopted. Firstly, she could have acknowledged the patient's feelings by saying something like, "I can see that you're worried about your house and that you're in so much stress." This type of soothing conversation can reduce emotional tension and helps the patient feel calm and relaxed. Secondly, she could have used reassurance with boundaries. Not false reassurance, but letting the patient know that her concern is legitimate while gently redirecting the focus by saying, "Right now, my priority is making sure you're medically safe, and once we are finished with this assignment, I can help you find someone who has updates about the situation." Thirdly, Olivia could have used a calm tone, slow pace, and a non-verbal communication such as sitting at eye level and talking with the patient such that the patient can feel more safe and he or she can have a sort of stress relief. A recent study from Padenha et al. 2025 states that understanding the psychological impact of trauma helps nurses to respond with compassion rather than frustration. Trauma and anxiety can significantly affect how a patient processes information, especially after experiencing a traumatic situation. After a traumatic event, the brain often shifts into a survival mode, where fear, confusion, and emotional overload can be more. This can affect the concentration, memory, and the ability to answer even small clinical questions which are very simple. A patient may become focused on only specific concerns such as the safety of their family or property because their mind is trying to regain its control. Anxiety also increases within the patient. Physical changes like rapid breathing, shaking can also be appear, which can make the communication mode harder between the patient and the nurse. In these moments, patients may become uncooperative, but often they are simply overwhelmed. Because of this, nurses need to change their communication strategies, like slowing down, using gentle language, maintaining a calm pressure, and providing emotional reassurance. If I were in Olivia's position, I would connect with Mrs. Osher on an emotional level. The first step would be acknowledging what she's going through by telling her, "Mrs. Osher, I can hear how worried you are about your home. That must be really frightening." This shows empathy that her emotions are valued. After that, I would ask her gently that before we can get more information about your house, I need to complete a quick assessment to make sure that you're medically stable. I'll go slowly, and I'll keep informed as we go. I would maintain eye contact, soften my voice, and give her time to answer, to think. If she becomes distracted again by anxiety, I would tell her calmly that I can understand your mind is in your home. Let's focus on the question first, and then I'll help you with the next step of dealing with your home. This kind of approach acknowledges her feelings, offers clarity, and maintains a calm mind, which can create trust and improve the accuracy of the assessment. It demonstrates both therapeutic communication and trauma-informed care, which are essential in emergency settings. To conclude, this case study clearly shows how important calm, respectful, and supportive communication is when caring for patients in stressful or emergency situations. When we listen, acknowledge emotions, and guide patients gently, it helps build trust and improves their cooperations. Thank you for watching.